Great. Thank you, Mr. Chairman. I want to get right into this. I share the concern of many of my colleagues about the failure of our public health establishment to have trust in it. And I think that has had lasting harm inflicted on America's children. And I know, Dr. Monterez, when we visited, I talked with you about this issue of trust in the CDC based on my experience as Lieutenant Governor during the pandemic. Because during that time, I know elected officials, parents, community leaders turned to the CDC for clear science-based guidance. And as Lieutenant Governor, who had to work with the governor every single day and managing through this pandemic, as a father of school-aged children, I experienced firsthand the effects of that guidance. And we were hoping that it was going to be based on the science. Everybody kept saying it's based on the science. And yet we know that now that guidance was based on politics and special interest. Instead of safeguarding children's health, CDC allowed activism to override science with devastating consequences. And I just want to give a few facts on how trust has been eroded. And by the way, we talked about not having enough money. Well, CDC now has 12 centers, but only 3 of them were authorized by Congress. And I think it's drifted from its original mission. And trust has been eroded due to these high-profile failures during the pandemic, failures that cost students years of academic progress. The House Oversight Committee found that the CDC gave the American Federation for Teachers access to edit school reopening guidance, inserting triggers that prolong closures. And this was not science, it was politics at the expense of our youth. The consequences of these widespread school closures were very measurable. The Wall Street Journal reported that math and science scores for 4th through 8th graders fell to their lowest levels since testing began. The New York Times confirmed that students in districts with prolonged closures fell as much as half a grade behind in math, while those that reopened sooner lost less ground. And the Hoover Institute projects that this learning loss will reduce in lifetime earnings for today's students of 5 to 6%, costing our nation an amazing $31 trillion in economic growth. That damage went beyond academics. The House Oversight Committee reported that suicide attempts by girls aged 12 to 17 rose by 51% during this period. Prolonged closures and confusing policies took a heavy toll on children's mental health and physical health. Even the CDC's universal masking guidance for children lacked evidence, went back and forth, and its own data showed no significant difference in the case rates between schools with or without masks. And equally troubling was the CDC's growing susceptibility to special interests through the CDC Foundation, which accepted private donations, including thousands of contributions routed through platforms like ActBlue, and with these weak safeguards, the agency left to police itself. It further undermined public confidence during this whole process. And we talked a lot about that. And this lesson is clear to me that when an agency is entrusted with science and it bows to politics, children pay the price. And we must demand accountability. We must restore the CDC's core mission of protecting public health on evidence, not ideology, and that we must never again allow political influence to dictate the decisions of our children's health, education, and future, whether that's with pandemics or vaccines. And I hope that there's nothing in that statement that you would disagree with, because I think that we had pretty much aligned on that during those conversations. And I know that with all of this guidance right now coming out, there's a simple question. For parents with healthy school-age children, are they endangering the lives of their healthy children if they don't get them vaccinated for COVID?
This is where a parent needs to have the ability to talk with their pediatrician and to really make sure that it is in the best decision of the parent and the child that vaccine, the COVID vaccine, is the benefits and the risks are well understood by the parent.
Okay, and would that apply to every vaccine?
So again, CDC doesn't make mandates; it makes recommendations.
Yeah, I'm just. See, in this particular case, if you listen carefully, we ask endangering lives, not whether it was recommended or whether it's a good thing, but would they be endangering the lives of their children?
I believe that the vaccines that have been proven safe and effective that mitigate the diseases, that if their child is exposed, like the measles or Hep B, and they have not been vaccinated and they have no natural immunity, it will cause very dangerous consequences to their children.
So this is, and I'll conclude, my time's up. This is where I think that we're getting it wrong. We shouldn't, I ask a pretty simple question, are they endangering their life? They aren't endangering the lives of their children. It may be a recommendation, it may be and there may be good reasons for doing it, and we should tell them that. But we shouldn't scare people in saying that we're endangering their lives, because I hear that all the time. And it's just an overstatement. We got to start leveling with people about what the truth is.
I agree that we have to have productive conversations with individuals to allow them to understand the benefits and the risks associated with these vaccines, and we do need to.
And thank you, Mr. Chairman. And the irony of this is when I talk with you, you say that. When I talk with Secretary Kennedy, he says this. We got to get this figured out.